professionals and employers. And to do this, we provide educational materials so that any advice is evidence-based and the workplace environment can be improved. EMAS celebrates every year the Menopause in the Workplace Day on the 7th of September.
And really just go out there and know that you're not crazy. This isn't all in your head. And what you may be experiencing is very, very real.
This is very, very important for all health professionals. And in fact, I think menopause management has been silent for almost 2 decades. Due to confusion and misinterpretations of benefits and risks with menopausal hormone therapy. And that led to that a whole generation of doctors didn't learn about menopause. And of course, this also has had consequences for women.
Every week I see how symptoms like poor sleep, hot flashes and brain fog quietly affects focus and confidence at work. Simple evidence-based steps like manager awareness, flexible breaks, temperature control and clear access to care can change outcomes and help retain talent. My one ask to employers: include menopause in your workplace health strategy and track outcomes like retention, sick leave and satisfaction. Ignoring menopause costs more than addressing it. It's time to treat it as a core part of workforce health.
A menopause-supportive workplace is one where the conversation isn't awkward, it's normal. It's a workplace which understands that menopause is not simply a personal issue. It's a well-being issue, a leadership issue, and a business issue. It's one where managers will stop and listen, where policies have a level of flexibility, and where performance is measured not by reference to assumptions, but by reference to context.
A menopause-supportive workplace means a culture where women don't have to hide what they're experiencing. It means awareness that symptoms like brain fog, sleep disruption, hot flashes can affect performance and responding with empathy, not judgment. It means training managers, normalizing conversations, and protecting women's confidence and careers at a stage when their skills and leadership are at their peak.
Hello, I'm Isabel. I'm a final year medical student, and recently I've undertaken some research into how menopause negatively impacts the NHS workforce. One factor which I found particularly interesting is that women really struggle to manage their vasomotor symptoms whilst on the wards. This is due to the NHS standard uniforms being made of a very thick material and due to the lack of ventilation on these wards. As these women are in high-pressured environments and high-pressured jobs, the additional menopausal anxiety and brain fog on top of this makes it very hard for them to manage.
On behalf of Turkish Menopause and Osteoporosis Society, I do strongly congratulate EMAS efforts to raise awareness around menopause in the workplace. We should never let any woman exit from workforce because of menopausal symptoms.
To me, a menopause-supportive workplace is one that cares for its people through every stage of life, just like pregnancy, parenthood or retirement. It's a place that values the wisdom and experience women bring and understand how important it is to keep that knowledge in the team. With care, flexibility and understanding, women can keep doing their best work and the whole workplace benefits.
A menopause-supportive workplace to me means a place where women who are going through the menopause receive the same compassion and understanding from their employer and work colleagues as any other individual who would go through any other health condition would receive.
What does a menopause-supportive workplace mean to me? It's staff working with staff to support staff to sail through the menopause.
A menopausal supportive workplace is a workplace where women feel safe, where talking about perimenopause and menopause symptoms is neither a taboo nor a problem, because colleagues, managers, human resources, medical support, everybody is aligned and knows that adjustments can be needed.
Menopausal symptoms significantly impact the productivity, absenteeism, and healthcare cost. Organizational cost and the loss of senior talent females are additional problems. Supporting women through workplace is not the only policy for healthcare, but also it is a strategy, economic strategy, to reduce the economic burden of menopause and to retain the experienced female.
As a business owner, I think of a clear return on investment. This means retaining talent, securing performance, reducing costs. As a physician, I know that a healthy work environment fosters a positive climate. This protects productivity in the long term and at the same time reflects the values we stand for: trust, mutual respect and innovation.
A menopause-supportive workplace means recognizing menopause as a natural part of life and creating an environment where employees feel comfortable discussing it without fear or stigma. It includes flexible working options, access to health resources, and supportive policies that consider the physical and emotional challenges menopause can bring.
To me, a menopause-supportive workplace is one that truly listens to its women. A place that recognizes our talent, experience, and abilities, but also gives space for the challenges of this stage of life. A place where we can be ourselves without any fear or stigma.
A menopause-supportive workplace means so much to me. When we started working on this topic a few years ago, I realised I'd been perimenopausal for years and hadn't realised it. And by building awareness in our own organisation and amongst our community of HR professionals, I was able to be more educated, open up the conversation, and in our own organisation, we really opened up the culture, and so many women received support, understanding, but also we found great allyship amongst our male colleagues as well, because menopause isn't just a female issue, it affects employers. They need to tap into that really valuable talent that we represent. There's no need to press pause on your career because of symptoms relating to what is a natural life event. So it's a win-win in that sense.
To me, a menopause-supportive workplace means an environment where the natural stage of menopause is understood, respected and accommodated, just like any other health or well-being consideration. And this would mean that there would be more awareness and education, more open communication and culture, more practical support and physical environment adjustments. So let's go for it.
Hello everyone and welcome on this great Sunday afternoon. My name is Petra Stute. I'm the president of EMAS and director of the Menopause Center at the University Clinic in Bern in Switzerland. And I'm delighted to open today's webinar on menopause in the workplace. We are at a unique moment. Menopause has gained enormous visibility in recent years in the media, in politics, and in everyday conversations. That visibility brings an opportunity, but also a responsibility to make sure the discussion is informed about facts, not by myths or headlines. The reality is clear. Menopausal symptoms can affect working life, and the workplace can in turn influence how women experience the stage of life. That is why we need evidence-based information so that policies, support and culture in the workplace are built on science and best practice. In our recent podcast conversations, we've heard from experts in health, psychology, HR, and policy. Their insights remind us that menopause at work is not just a medical issue, it's also social, organizational, and cultural. Today's session is a chance to continue that dialogue, and I'm very much looking forward to the perspectives we will hear. With that, I'm pleased to hand over to my colleague Judith Boban, board member of EMAS. She will guide us into the first part of today's program.
Hello, thank you, Petra, and hello, everyone. My name is Judith Boban. I'm a gynecologist working in my own practice in Vienna with a special focus on menopause care, which is a field I'm truly passionate about. I also have a business degree, and before becoming a doctor, I spent 7 years in management roles at Procter & Gamble. So this combination allows me to build bridges between healthcare and workplace realities, something I find very helpful when it comes to addressing menopause in the workplace. And almost everything I know about hormones and menopause I learned from Petra when I worked with her at the Menopause Center in Bern. And ever since then, we've been working together on something very close to our hearts, bringing menopause into workplaces by visiting companies, raising awareness, and offering trainings and workshops. And so it's a real pleasure to be co-hosting today's webinar together with Petra today. I also want to welcome our friends joining us live on LinkedIn and YouTube. We're delighted to have you with us. Just for your information, you can follow the stream here, but all interaction will take place on Zoom. Before we dive in, a few quick housekeeping notes. One, if you'd like to ask a question, please use the Q&A box at the bottom of your screen. Second, the chat is also open for your reflections and comments. Just keep in mind that we will prioritize questions submitted through the Q&A. And third, today's webinar is being recorded, so everyone registered will receive the link afterwards. And if you'd like captions, just there's a sign, click the CC button at the bottom of your Zoom screen, and you will see then AI-generated subtitles. In today's webinar, we're bringing together different perspectives from healthcare, HR, research, and lived experience to talk about menopause at work and what kind of support can really help. So let's kick off with a short poll. We'd love to hear about your own experience with menopause in the workplace. So please take a moment to respond, and then we'll look at the responses together. So has menopause ever been addressed in your workplace?
Maybe you can read the questions, huh?
Okay, just in case, yes. So the answers would be yes, we have a policy or framework in place. Yes, informally or through personal conversations. No, but I believe it should be. No, I'm not sure how to start the conversation. Or I'm not currently employed, or it doesn't apply to me.
All right, we will wait for a few seconds more since I see that many people are participating.
So quite a diverse range of replies, but interesting, I find that the leading answer, no, but I believe it should be. I think that reflects basically where we stand today in our conversation and why this should be addressed more, even more. I think it's an interesting standpoint to start the discussion. What do you think, Petra?
Yes, as we can see, experience really vary widely. So some of you already have policies in place, others rely on informal conversations, and for many the topic hasn't been addressed at all. That really reflects the global picture, I would say. Progress in some areas, but still a long way to go. To bring those responses to life, we want to start with a personal perspective. Because behind every policy, or lack of one, there are real experiences at work. I'm very pleased that my patient, Tuba Eichenberger, has joined us to share her own journey of navigating menopause in the workplace. Her voice is a reminder of why this conversation matters. Tuba, thank you very much for being here today.
Hello. Hi. Glad to be here. Thank you.
So, can you briefly introduce yourself to our audience, please?
Yes. So my name is Tuba Eichenberger. I live in Switzerland. I was born and raised in Germany, but I have Oriental and American ancestors. And from profession, I am a classically trained singer, a dancer, and an actress. I have a Bachelor of Fine Arts from an American university and have been working in Europe for the past 35 years.
Thank you.
Hi, Tuba.
Hi.
I have a question for you. When did you first start noticing menopausal symptoms, and how did they affect your daily life, especially at work?
Well, yeah. I was about 44 years old, and I didn't know it was the beginning of menopause. I mainly was sweating like a pig, if I may say so. And something I never knew in my life, because even as a classically trained dancer, I used to get opinions by my teachers saying, you don't work hard enough, you don't sweat. So that was really very new, and I did not understand what's going on, but it was very, very bothersome.
So now you already told us about the vasomotor symptoms that made you drop harder. But what was your impression about if the symptoms, if they also affected your confidence at work?
I did, especially because I never sweat. I was always afraid that people would be disgusted because I had close personal contact. So you could see, even if you couldn't smell it, but you could see that I was sweating. And that was very, very uncomfortable.
Mm-hmm. And how did you feel talking about it? I mean, did you feel you could talk with your, I don't know, would you call them managers or colleagues?
My working situation is a little different from many people's. I don't know if it's better or if it makes things worse, but I have in 1 year 8 to 10 employers because I work independently. So of course you could say that I can hide it better because I'm not there every day. But on the other side, since they see me once and everything has to be perfect, because they asked in advance and they pay me and everything, I felt a big responsibility to deliver on point. And the sweating business really messed up things for me. And I was really quite embarrassed. And yeah, many modern buildings don't even have windows. So you can't just open the window and let some fresh air in. And the sweating was the same in summer as in winter. It didn't make a difference. And yeah, I was a very easy handle to an employee who was easy to handle, and I never asked for anything extra. And so I did not want to destroy my image on the other side. I just looked that I could maybe take off something. And sometimes when cameras were switched off, I just undressed and I was sitting there in a bra or my underwear when I felt safe, when there were no men around. And I told them some story why I'm hot, but had nothing. I never mentioned menopause.
But now you really are in a good situation that you can compare different workplaces.
Right.
So that's why I'm wondering, so has any of the workplaces you worked in offered any kind of support, and what kind of support would have been helpful for you?
Well, unlike a lot of other people, I had a lot of managers and chefs and directors who were females themselves, but nobody ever asked me, what's going on? How come you're hot? Or how come you're different? Because you are different, of course. You behave different, you move different, you start being a little impatient, you want to hurry because you want to leave. Nobody ever asked anything. And I'm sure they noticed. I mean, there's no way that they did not notice that there's something different. I don't want to say wrong, but different. It's very surprising to me because I always have empathy with everybody, and I always see when people are not comfortable or when something is different, and it doesn't hurt to ask. But no, they didn't. And I wish they would have. Then I could have at least say, I don't know what's going on. Or later, when I knew I had menopause, I could say, is there a way I could get a different room, a room with a window? Could you organize a fan for me? It's just too hot like this.
So basically, you already answered my next question. Like looking back, what was, or actually, what was most helpful for you during that time? Was there anything that was helpful, or was it just the situation itself you're dealing with?
I have to say that the most helpful thing was my doctor. And I like to stress a female doctor because I was in good hands before, but that was a male doctor, a renowned professor who's normally very good to me and to all of his patients, but he simply did not know what to do. And in the end, when it was kind of clear that's probably menopause starting, he actually did say to me, oh, I would just sit it out. Mm-hmm. I don't know what to do and how to help you. You should just sit it out. But I fought to go see, that was by chance, Professor Stute, because I heard about her and I knew that she's working in menopause, and I had to fight to get a referral. And in the end, he was so desperate that he gave me one because he saw that I'm not doing well. And by then I had symptoms like this impatience. I was not a very nice person to be around. I had problems with my memory, with concentration. And, he was just sick and tired of hearing about it. So he gave me a referral, and that saved, for me, literally my life.
So by not helping you, he helped you.
Yeah, basically. Yeah, right.
So first of all, thank you very much. But now, of course, I have another question. So if you could tell employers now one thing about menopause at work, what would it be?
Well, at a certain age, like after 45 or sometimes even 40, there should be open communication about these things. And as soon as you notice a change, as soon as you see someone sweating like that and you never saw them before, just go and ask them, is there something we can do for you? Just a simple question.
Yeah, simple question, but so difficult to ask, right?
I know.
Has this experience changed the way you look after your own health or the way you speak up for yourself when it comes?
Definitely. It taught me that I deserve respect. That was a big issue in my life. As an artist, you always want to render to everybody. You want to entertain people. You want to make their life better. And through these problems, I learned that I do deserve respect, and I deserve myself and other people to support me and to put myself first sometimes, to say, I'm having a bad day. Please don't ask for more. I'll do my job, but have respect and be patient with me if I need an extra break.
I think that's already a very clear and strong statement. And but maybe is there any final thought that you would like to share with everyone watching today?
Yeah. Don't be shy and don't be vain about it, because menopause is a natural and very normal part of a woman's life. You know, there's nothing to be ashamed about. It's like when you're very young and you get your first period, you might be embarrassed about it, but later you learn, hey, that was silly that I was even embarrassed or thought about it. And it's the same with menopause. Really, there's no reason to be vain. I understand, because you people put you in a drawer that you're an old woman now. So what? We live in the best worlds for women as ever. So we don't have much to complain about. And we should support other women by normalizing it.
Thank you very, very much, Tuba, for sharing your experiences with us and also for giving us your advice. So with that, I think it's now the right moment to move from lived experience to the professional perspective. And with that, I will hand over to Judith, who will introduce to you the next speaker.
Thank you, Petra. Yeah, our next presentation turns to an essential aspect of this conversation: menopause and mental health at work. And I'm very pleased to welcome Dr. Silvia Fernandez Biesa, a psychiatrist with more than 25 years of experience. And she will share her insights on how mental health intersects with menopause in the workplace. Silvia's talk will be followed by a few minutes of Q&As and discussion, so please feel free to add your questions in the Q&A box as she speaks. Silvia, the floor is yours.
Thank you, Judith. Good afternoon to everyone, and thanks so much for being here today. I'd like to thank Professor Stute and everybody who made this event possible today. It's truly a pleasure being with you today, with the organizers, with the presenters, and the organizers. I am Silvia Fernandez Biesa. I am physician, psychiatrist, and psychotherapist. I serve on the EMAS advisory board. Maybe you can hear that I have a Spanish accent. Well, that's true. I come from Spain, and since I am living and working in Switzerland for a couple of years, well, I bring both perspectives with me to my work. Let me quickly start my presentation. Over the past few years, I have become deeply engaged with the topic of menopause, not only as a physician, but also as a woman who is experiencing this transition myself. What I have learned, both personally and professionally, is that menopause is not just another stage in a woman's life. It is a profound transition that affects women in various ways: body, mind, and emotions. And still, there is too much silence about it. Too many taboos. Today, I want to focus on one essential question: how does menopause affect mental health and workplace? And what can we do about it? And let me clarify something right from the start. In this presentation, whenever I use the word menopause, I refer to menopause or transition. I decided myself to use the word menopause to make it short and clear. When we think of menopause, most people immediately think of hot flashes or night sweats. But the mental health impact of menopause is just as important and in most cases more challenging. Many women suffer from anxiety, fatigue, brain fog, sleep issues, and mood swings. These symptoms are maybe invisible, but they have very real consequences. about the way women feel about themselves, how they function at home, and importantly, how they perform at work. Let me share some numbers. About 75% of women between 40 and 60 struggle with menopausal symptoms. 65% have difficulties with concentration, memory, and planning. And almost half report a reduction of performance at work. Now imagine a woman who's leading a meeting after a sleepless night, or a woman trying to make an important decision at the same time as she's struggling with emotions she cannot control. As we will see, there are main reasons to explain why does it happen. Some of them are biological. I want to focus today in mood swings in menopause. In fact, up to 70% of women in menopause suffer from mood swings. Some of the menopausal women I've worked with referred having a depression during menopause, but it was actually mood swings. They are similar and easy to confound. Mood swings are sudden and short emotional shifts from irritability to sadness, anxiety, and then return to normality. And as I said, is a key symptom of menopause. On the other hand, a depression has similar symptoms, but they are longer. And maybe some of women suffer also from other symptoms like hopelessness or lack of interest for normal activities. A depression is a medical condition. Why do these mood swings happen? They happen mainly because of hormonal changes. During menopause, estrogen levels begin to drop and, importantly, they fluctuate. Estrogen is not only about fertility. It plays a main role in brain function. When estrogen levels begin to decline and fluctuate, this triggers a cascade in brain, beginning by affecting serotonin and noradrenaline pathways, then influencing in the levels of neurosteroid, and finally altering GABA activity. This cascade leads finally to the mood swings in menopause. While the main cause is hormonal, there are other factors that can make that mood swings are more likely in menopause. These are: some brains are more sensitive to hormonal changes. A backpack heavy from unresolved emotional conflicts makes it more possible. Physical symptoms of menopause like pain and hot flashes also play a role. In some cultures, there are special negative cultural beliefs about aging and menopause. And finally, stressful life events, which very often happen at this stage, like taking care of aging parents or children leaving home. All of these factors interact with hormonal changes, like a storm in brain, so that it is easy to understand why mood swings are so often in menopause. The good news is there are ways to manage and prevent at an individual basis. I will try to begin with hormone replacement therapy, which balances estrogen and progesterone. Second, psychiatric drugs like antidepressants and mood stabilizers who regulate mood and sleep. Cognitive behavioral therapy. This is a psychotherapeutic approach which helps us identifying negative thought patterns, and learning new coping strategies. Hypnosis is also a possibility. Besides treatments I have enumerated, considered as best practices, there are other tools that can also be helpful. For instance, lifestyle changes. This includes taking care of your sleep and your diet and adopting, for instance, a Mediterranean style diet. Or body-mind exercises like yoga, tai chi, qigong, and meditation. If I can offer a piece of personal advice, that would be prevention. Prevention can be as important as treatment. And to begin with it soon enough, in the mid-30s. I think at this moment at a life coaching program based on cognitive behavioral therapy or at other programs offered by colleagues of mine. High quality therapy helps women in all areas of life. While taking care of ourselves is essential, we also know that women do not experience menopause in isolation. That's why environments where we work in play a huge role in supporting health, well-being, and performance. That's why support shouldn't stop here, but workplaces also play a vital role in helping women navigate this transition. I think we should look at menopause not only individually, but collectively. And doing so, it's not only women who benefit, but workplaces themselves also gain. From a health perspective, a menopause-friendly workplace creates supportive environment and protects health and productivity. From a human perspective, a menopause-friendly workplace fosters trust, mutual respect, and innovation. From a business perspective, a menopause-friendly workplace retains talent, secures performance, and reduces costs. In short, women stay healthy, feel valued, and remain productive. Let me leave you with these 3 key messages. First, menopause has a strong impact on mental health, and this includes brain fog, sleep disturbances, and mood swings, which also affect the work performance. Second, solutions exist. A multidisciplinary support, including individual and workplace-based strategies, can make a difference. Third, menopause is not the end of vitality. It is a stage of transformation. With awareness, resilience, and solidarity, we can make it a positive and empowering experience for women and for everyone. Thank you very much for your attention.
Thank you so much, Sylvia, for sharing this information, for the experience with us. Your insights have shown how important the mental health perspective is for understanding also then menopause at work and how all the different aspects of the psyche can influence your performance. Petra, have you seen questions?
Yes, but in our Q&A section, we have some questions, but maybe I can start with the first one, because first of all, thank you very much, Sylvia, as always, very impressive. And I was wondering, you said that unsolved internal or inner conflicts may also increase the symptom burden or the mental health issue or symptoms. And I'm wondering, so from your experience, do women know that they have an unsolved inner conflict, or is this something which turns out after consultation or during consultation?
I'm not sure if I understood your question. Are you asking about anxiety or conflicts?
You said that unsolved inner conflicts may also have some impact on mental health issues.
Yes.
And I've been wondering if I was now a patient, or if I'm obviously also in menopause, but do I realize that I have unsolved inner conflicts, or is this only something if I go to a therapist, which then will be found out that I have some unsolved inner conflicts?
Yes, I understood. Well, from my perspective, it's both.
Mhm.
Some people reflect or have reflected about their personal life and already identified some conflicts in their past, and some other didn't. But also women who already reflected and come to us with a to-do list, so to say, through the reflection experience more details in these conflicts. The process of explaining, the process of identifying which causes, which has happened, this helps a lot during the process of psychotherapy. But of course, there are people who think, no, my life was always so easy. And once they began to reflect, they can identify a couple of things that obviously have their impact in life. So it's not so easy to respond with a yes or a no. It's depending from the situation. I think for all cases, the reflection, the self-reflection empowers women.
Thank you. So we have received some more questions in our Q&A section. Judith, do you want to start with one?
I mean, actually, I have a question while reading through things. Someone mentioned that psychodynamic therapy is also very helpful. I have no idea what psychodynamic therapy is. Maybe you could explain a bit on that.
Well, psychodynamic therapy is a special therapy based on the studies from Sigmund Freud and other colleagues. And of course, it's a very helpful one. It's a very intense one, a very long one. I mentioned only cognitive behavioral therapy in my presentation, not because it's the only therapy that helps, but because it's the only one who is accepted from international menopause societies as best practices. But I agree, I completely agree. Psychodynamic therapy or other therapy can be very helpful.
So maybe we can take one question addressing women with a past history of childhood trauma or parental loss at an early age who have disabling symptoms in menopausal transition. Also more women who appear to present with features of ADHD for the first time. So do you see this?
Mm-hmm. Yes, it's about two different cases. The first one with past childhood trauma because of this strong or heavy backpack that it influences a lot. How do you experience menopause? It's more likely to suffer on mood swings of menopause with this past. So I encouragely recommend to visit a professional in this case. And ADHD in women experiencing menopause is very often. I try to explain this as a compensation through all the life with methods we've learned, and ADHD is not going to be objectivated till the moment where menopause symptoms began, where also a cognitive impairment begins, and then the resources we've learned during all our lives and allowed us to have a compensate level are no more useful. So short, yes, it is very often, and we see it very often in the consultation. Women with menopausal symptoms consultate for the first time for these disattention symptoms. Also, it is not for the first time known, but it affects to the real life for the first time, so to say, but because of this lack of compensation with the measures each woman has learned in her life.
Okay, thank you. I have one last question. Is it true, as some studies suggest, that educational level and social status also influence how women experience their menopausal transition?
Well, at this point, I think Frau Stute is the expert, and she's doing some research at the University of Bern at this point. As far as I know, yes, it has a strong influence in the way how women experience menopause. As I said, in some cultural settings, the image of menopause and of aging is quite frightening. It doesn't help. I think an image of accepting or a positive image of menopause helps going through this transition in a better way.
Okay, thank you. Do you have any other question you want to ask? I think we have to watch the time a bit. Petra, what do you think?
Yes, I've been wondering if we somehow could collect those questions. Lina, who is actually our support for the whole session in the background, maybe Lina, you can just collect the questions, and then we can think about how we can present the results on the EMAS homepage. Because I also just realized we have so many questions that we are not just, because of time, we are not able to answer all these, but I want you to get the answers for all your questions. So maybe Lina can collect them, and then we will let you know how you will find the answers on our homepage. Okay.
So sounds like a good plan. I think also you can just keep on talking now, Petra. It's your turn.
Okay, so thanks then. So thank you again, Sylvia. And now our next session takes us to another crucial dimension of the workplace discussion: recognition of menopause symptoms as a key to gender equality in extended working lives. I'm very delighted to welcome Professor Niki Lefebvre from the Faculty of Social and Political Science of the University of Lausanne in Switzerland, who will share her expertise on this important topic. So Niki, welcome, the floor is yours.
Thank you. Thank you so much, Petra. Hello, everyone. I'm absolutely delighted to be here this afternoon, and I congratulate everyone at the EMAS board and chair for setting up such an inspiring event, even though it is on a sunny Sunday afternoon. But that's okay. We don't mind that. It's for a good cause. So yeah, I'm going to change.
Sorry to interrupt. Just one. If you could please switch the view so that we can see your full screen. Exactly. Yes. If you can click
Okay, is that better?
Excellent.
Thank
Absolutely.
you
Thank
so
you.
much, Lena. Okay, so as I was saying, I'm going to change perspectives a little. I'm a sociologist, professor of sociology at the University of Lausanne, and my interest is in how the menopause transition fits in with overall global perspectives on extended working lives, so increasing the percentage of women who remain in employment for at least up until legal retirement age, and questioning how aging at work can be thought about in a more gender equal way. So my research is taking place at the moment under a project financed by the Swiss National Science Foundation, along with my colleague Isabel Zinn, who is working in Bern. We have a project that is only just started, so it's called Health and Aging at Work. We call it the HAWK study, and we are using menopause as a way of getting into the issues around aging at work and gender equality. Obviously, we don't have any results to present today because we're just getting started, but the idea is kind of to present the background to our project and to maybe raise issues from a more macro-social or maybe from a more organizational perspective. So I'd like to start by talking about the policy context, which I think Petra Studer mentioned earlier, and I think it is very important to say that we are at a very good point in a way of getting menopause on the policy agenda and also getting organizations involved and interested in the issue. Up until very recently, the extended working life policy orientation was based on two assumptions: that it was inevitable that men and women were going to have to carry on working for longer and longer, because otherwise the sustainability of our pension system and welfare systems, at least in Europe, would be under threat. And the way people thought about this was really with a rhetoric of individual choice and responsibility. I take this citation from the OECD 2015 report: people are increasingly free to construct their own biographies. So we had this vision of individuals that were sort of like floating objects and that were able to decide for themselves how they should age at work, whereas before they had been tending to leave work when they were becoming affected by aging, signs of aging, including menopause. So up until very recently, most of the policy initiatives were focused on rewarding work and later retirement, with little concern really for women's health or for well-being aspects of extending the duration of working life. I believe that there is some sign of a policy shift at the moment, and that policymakers and organizations are increasingly recognizing the importance of adopting a life course and an organizational approach to extended working life. From the more recent OECD report, we can see this citation: we need workers who want to work longer. So that's the kind of individual rhetoric side of things. But we also need employers who want to employ them. And it seems to me that this renewed attention to demand side barriers resonates with the EMAS vision, and also was something that inspired our ongoing HAWK project. We're in a situation, again, from a European perspective, where we're shifting from preoccupation with job shortage to preoccupation with labor shortage. And this is a new challenge of population aging. And we can see from this new OECD policy wheel that encouraging employers to retain and to hire older workers is becoming more and more important, and therefore getting organizations to think about how workers age and to think about how women move through the menopause transition whilst remaining in employment is something that is very high on the policy agenda. And I think it's good to know that and to foster that interest to make life easier for women. Recognition, of course, is coming from organizations, from trade unions, from media, that the issue of menopause and recognizing menopause and supporting women through the menopause transition is a key to extending women's working lives. And since that is the policy objective, then that key should be taken more and more seriously. Okay, just a few background statistics. I'm not going to bore you too much with this, but I think it is important to see exactly what's going on. We know that the employment rate by age group, certainly in Europe, is increasing significantly over time, and it's the middle range age group where more and more people are remaining in employment. We nevertheless still have quite significant gender gap in extended working life. Employment rates for women and men over the age of 55 are still very different, and there is this curve that shows that there is a dearth of women remaining in employment or being in employment at that specific age group at the time when they will be experiencing the menopause transition. So there is a lot to be gained there. And we know also that women tend to be in employment sectors that are particularly badly hit by labor shortages and by the need to retain and recruit women in that older age range. So this is important, I think, to remember, along with the organizational issues, organizational contexts. There is actually a very big issue about women's working conditions in general. And this, for me, seems to be a big issue when we're talking about how organizations recognize and deal with the menopause transition. If men and women, especially men and women over the age of 45, are faced with unsocial work schedules, lack work time flexibility, these are issues that have to be addressed generally, and addressing them generally will avoid stigmatizing women going through the menopause transition, but will also improve working conditions for the majority of people. And this, I think, is a strong line of argument to defend. What we see generally is that women are as affected as men, sometimes even more, by intensity of work. We tend to have these stereotypical representations of women sitting, quietly behind desks and men being involved in physical jobs. In actual fact, that doesn't show up in the working condition studies. But more importantly, I think women tend to lack autonomy and discretion in their jobs. And I think Juba's interview was very illustrative of this. What is important in organizations when they are thinking about helping women through the menopause transition is to give women the autonomy and discretion to organize their work as they see fit, or as they see they need to have it organized when they are facing different symptoms of varying intensity over time. Also, of course, I'm kind of pushing through open doors here, but it is very important to remember that women have a subjective perception of their career prospects, which is much, much lower in these age ranges than men. So the question of encouraging women not only to stay in employment, not only to respond to their own needs, but also to see that organizations are offering them interesting career prospects even in these older age phases is one thing that we could do to help women with their experience of the menopause, and also help organizations retain women who are going through this transition. And these are issues that are not just about the menopause, but we can see how they are organizationally, they have a huge impact on how women can manage their symptoms. One other issue is the question of women's role in organizations. Are women listened to? Do they feel that they have an influence over decisions? Do they feel that they are being consulted over work organization issues? The answer is clearly no. And this is particularly the case for women over the age of 50 or 55. They personally think that they have less influence than other age groups and than men over their work arrangements, and that they are not listened to. And so this is also one general activity, one general improvement that can be made to how women are treated within organizations. So now a few words about the Health and Aging at Work project that we are working on in Lausanne and Bern at the moment. We are sociologists, we are qualitative sociologists, and we are dealing with a context that has been often described as conservative or neoconservative. I think it is very important when we're thinking about how women experience the menopause transition to think about the overall gender regime within which they are living at the time when they go through this transition. And our working hypothesis is to say that this is actually something that impacts quite significantly on their experience. In Switzerland, we still have what has been termed a modified male breadwinner gender regime, quite conservative, a high percentage of women working part-time, women still providing the massive domestic labour and care, a lack of affordable care solutions, be it for childcare or for elder care, and long working hours for full-timers. And this provides a kind of backdrop to how organisations are then addressing supporting women or not supporting women through this transition. This means, of course, that the women in Switzerland are highly penalised for their discontinuous employment histories. The occupational gender pension gap in the country is enormous. I have to say that this male breadwinner model is particularly prevalent in the German-speaking cantons, and that women do tend to increase their working time as their children get older, but that not enough to get over this gap. What does this mean? The occupational gender pension gap? It means that women are actually financially motivated, increasingly financially motivated, to remain in employment through their menopause transition years and beyond. And therefore, what organisations need to do in order to respond to that aspiration from women is to offer them something more than just reducing their working hours, because reducing their working hours will further increase the gender pension gap further down the line. So this is a very important contextual issue, and I think we need to look at how this takes place in different shapes and forms in different countries and in different organisations. Here, just a few words on our research objectives. Our idea is to map women's experience of the menopause transition in different occupations and in different organizational settings. So very clearly, we are working with the hypothesis that not all women go through this transition in the same way. Looking at the severity and the duration of symptoms according to social class, according to ethnic background, according to whether women are doing manual or non-manual jobs, understanding how these menopause symptoms impact their employment patterns. So do they increase their working hours? Do they reduce them? Do they take early retirement? Do they extend their working life? And also how they see their career opportunities. We know that women's careers take place later than men's. And so there is this overlap between the menopause transition and women catching up on slower careers that they may have had earlier on in their lives. And of course, we're interested in understanding more how the menopause transition affects women's health and well-being in later life. And our focus is going to be on organizational awareness and responses to the menopause transition, looking at the role of human resource services, line managers, peer group interactions, and of course, something that was mentioned earlier, understanding better the tension and how the tension can be resolved between providing organizational support and avoiding social stigma and discrimination that women may face when they make claims on their needs for support through the menopause transition. We have a quite complex and multi-level research design. So we'll be carrying out an online survey on a wide range of female workers, principally in the hospital sector. Hospital sector was chosen because we have women working there, a lot of women working in that sector. It is a sector that's facing severe labor shortages, and it's also a sector where we have women from different levels of education, women from different backgrounds, so we get a nice spread of experiences. After the online survey, we will be carrying out biographical interviews in order to understand women's subjective experiences a little better, expert interviews with HR and line managers, and then some ethnographic observations of menopause clinics and workshops, and trying to see what it is that the menopause does to women's ability to carry out their jobs or to aspire to remaining in employment. As I say, focus on the healthcare sector because it's highly feminized, a variety of professions facing short staff shortages, and also structural occupational health issues related to asocial working hours and stress and other issues that we know interact quite significantly with the way women can deal with their menopause transition. Okay, this is just a bit more complicated description of what it is we will be doing, the way we've designed our research model. And to conclude, I would invite you all to keep an eye on the results. They will be published on our website as they come through. And basically, the take-home message is to say that menopause is a collective social experience as well as an individual psychological experience. And we feel that it is very important to understand what are the organizational and what are the policy initiatives that can make that experience less difficult and less traumatic for women, and also more productive for organizations and enterprises. Okay, so thank you very much.
Thank you very much, Nikki. So I'm very much looking forward to the results. And to be honest, I'm so happy that you focus on the healthcare sector, because usually you would think, you know, that the healthcare sector would be the first one to be interested in women and menopause at the workplace. But this is not the case. So I'm very much looking forward to why this is actually not the case. So yeah, thank you very much. I think we have time for one more question, because I really like I'm looking forward to your answer to this question. So how can we fight discrimination, particularly in the UK, which is related to offering healthy women with menopause, with previous professional careers, who are looking for jobs, only low-level jobs? For example, a clinical psychologist is being pushed to accept entry-level jobs or in retail.
Yes, I mean, obviously, this is an obvious example of the kind of discrimination and the kind of difficulties that women face when they are going through the menopause transition. I mean, I think we have to really make organizations aware, and also women themselves aware, of the fact that this is a transition, right? This is something that is limited in time. It can be very disturbing or less disturbing depending on individual women. We know that, you know, not all women go through menopause symptoms that have a debilitating influence on their ability to carry out their jobs. But clearly, there's absolutely no reason why women should be demoted when they are going through this experience. What they need is support to continue in the jobs that they have invested in, that their company has invested in, and the idea that women should be sort of sidelined off or sidelined down to less demanding or less prestigious or less well-paid jobs is something that I think we collectively have to resist very strongly. And so far, there hasn't been an awful lot of trade union mobilization around this issue, but I get the impression that this is something that is coming up on the agenda more and more frequently, and naturally so, because the share of women going through this transition and in employment is increasing. So, you know, their visibility increases, and also the amount of media coverage that this issue receives is increasing. So I think, yes, we should refuse any idea that women need to be demoted in order to manage their symptoms, and we need to help them manage them where they are, where they're at, and even envisage the fact that they could have, you know, promotion and career opportunities while they are going through the transition, or at least after the transition, if the symptoms are very difficult. So, yeah.
Thank you very much for this clear statement, and thank you very much, Nikki, for that excellent contribution and presentation. As I already said, I'm very much looking forward to the results of your study. And to take us forward, I will hand over to Judith again, who will guide us into the next part of the program. So Judith, please continue.
Thank you, Petra. Well, our next contribution comes from Professor Kathleen Riak from University of Glasgow. She will share her perspective on occupational health and how it connects with menopause in the workplace. So this is a recorded presentation. So unfortunately, Kathleen isn't here with us to answer questions. Still, her insights form an important part of today's discussion. So let's listen to Kathleen's talk.
Kathleen Reich. I'm a professor in organisation studies, and happy Menopause Day, everyone. I've been asked to speak for about 10 minutes or so about menopause and occupational health, looking particularly at the UK context, but also some broader messages and lessons and opportunities internationally as well. So I thought I'd start by beginning to think about what occupational health is and what it can do or not do. Now, occupational health is usually a group of doctors, nurses, physiotherapists, psychologists and other healthcare professionals who are either part of an in-house team to support health in work, or an outsourced team that belong to a large organisation, usually a private organisation that a company buys in order to help support their workers. Now, it's really important because occupational health is really fundamental to protecting workforce health by managing that work-related illness and injury, and ideally to keep people in work or help them in terms of support and rehabilitation back into work. Occupational health is also really central in terms of advising on workplace adjustments for employees, but also how we can get them back into work in whatever capacity they can. Now, that's really, really important given we know that ill health is one of the leading causes for long-term unemployment and long-term economic inactivity. Occupational health also ensures the legal and ethical compliance around equality duties, but also around health and safety legislation as well. At the same time, there are some challenges with current occupational health systems. We know only around 50% of employees in the UK are covered by an occupational health scheme, although there has been discussions around having a nationwide approach to occupational health in terms of public service. And we also know that occupational health, just by virtue of being a resource limited offering, is often lacks a kind of proactive approach. It's not systems led in terms of thinking about broader structural barriers to healthy work, and also it can often come too late. So people are referred to occupational health by their line managers or their teams when there's actually been a problem or a health challenge for quite a long period of time. So by this, you can probably already see why occupational health is really central to menopause support in the workplace. As I mentioned, we have significant numbers of working days lost due to economic activity, but in particular for menopause, we have 40 million working days lost due to lack of menopause support in the workplace. At the same time, we know that occupational health is really central to keeping people in work. We know that for every £1 invested in occupational health, there is a £1.97 return due to increasing people staying in the workplace and reducing absenteeism. So a real business case there. At the same time, we know occupational health as a profession has particular challenges in terms of its own diversity of lived experience of experts. So, for example, 97% of occupational health physicians are men, leading to a lack of gender balance as well. So how can occupational health support menopause? Well, I think one of the key things around occupational health is that there is a strong credibility of the profession. Occupational health is embedded in a lot of organisations. It helps support the kind of legislative duty, but also, unfortunately, as we know, because there's been a rolling back of ED&I support, equality, diversity and inclusion support in many parts of the world, occupational health provides an alternative or an additional part of the business where we can start talking about menopause support and providing menopause support. Occupational health also provides anonymised data. And with this anonymised data can help us identify trends that are happening in our workplace that would hopefully lead to more proactive approaches to supporting menopause through structures and practices. Menopause, occupational health, because it is populated by health professionals, provides a really valuable health-centred voice in the workplace. Okay, so it's of course it's really important to think about those social and cultural norms, but we also need to have a kind of credible, health-centred, evidence-based knowledge base around menopause in the workplace, and occupational health can really provide that. And then finally, occupational health has the potential to connect different risk elements in the workplace and their possible outcomes. And ideally, what we'd really like to see is an occupational health infrastructure and ecosystem that allows us to identify those barriers or those kind of constraining aspects that stop people in menopause feeling supported in the workplace, and make sure that we have those systems and structures in place that would support them without them having to kind of go through particular processes to allow those adjustments. So some examples, some kind of practical examples where occupational health plays a role in menopause support in the workplace. So the first one is around environment. So we know that occupational health can make recommendations or audit aspects around temperature. We know that they can encourage us to think about materials that are used, both uniforms and also materials in the built environment. So what a chair's made of, and so on and so forth. Occupational health can also give us information about the disproportionate impact on certain employee populations on things such as shift patterns, for example, and make sure that we're mitigating them where resources are make that possible. The second aspect around occupational health is that it does provide tailored approaches and tailored solutions for individuals. Now, given that menopause is such a complex constellation of symptoms, and also that these are dynamic and change over time, these individual plans we know can be highly effective in helping supporting employees stay in work and keep in work through menopause. There's a focus again on keeping people in work, and that's one of the advantages of occupational health. It's not about getting rid of people, it's about making sure that people have in their capacity, they have the support networks in place to keep them in work or bring them back into work after periods of absence. But of course, one of the limitations there is that often occupational health steps in too late to do that. And that's actually really important, because we know, for example, in the UK, where we have a public health system, only 4% of total expenditure is spent on preventative health in our National Health Service. So we're actually relying on organisations to provide that more proactive approach to workforce health. And occupational health is at the moment, due to resources, just often limited in accessing, people access support too late. In terms of health centre cultures, occupational health can help us recognise both the physical and the mental demands of work and how they connect together. It also provides us with opportunities to think about conversations and awareness about where gender-specific health issues or gender-specific health experiences emerge and intersect with organisational demands. We know traditionally that in terms of line managers and managers, often the only gender-specific discussion that happens is around pregnancy. So this is a kind of new, this is a forum where potentially we could have those gender-specific health experiences discussed. And finally, it has the potential to really mainstream health-based conversations in the workplace. We know that menopause is a natural life course event, and it's a health-based natural life course event, and occupational health can really provide that education and awareness around that if they have resource to do so. And then finally, practically, occupational health can help menopause support through providing data. So they will have data on absenteeism, they'll have data on managerial escalations, and also they'll have data on hotspots of concern. When we think about this around menopause, what that should allow us to do is have a data source that can help us advocate and provide more proactive solutions around the built environment and structures of work that become menopause, that are menopause supportive. So last, I wanted to have a discussion about, hopefully you've seen kind of, there's real opportunity there for occupational health to be central to the conversations around how we support menopause and work for all our employees. But I wanted to kind of really push it a little bit in this forum and think about, well, what else could occupational health do? What's the potential of occupational health to really support menopause and make significant changes that support all employees in the workplace? And there's really a kind of, I've brought up the acronym here, CEST, for that in terms of collaboration, spaces and cultures. So the first one is occupational health collaborations. How can occupational health work collaboratively with human resources, with estates and facilities, as well as HR, to help audit and prevent those barriers that we know provide hostile or unsupportive environments for menopausal employees. They can also recommend innovative adjustments that come from a kind of health-based perspective, so giving managers new insight into what they could do creatively to provide flexibility and support for employees in their workplace. They can communicate those trends, those patterns and exposures that they see from the data that they have, and also they can think about how they communicate depending on whether they're an in-house connection, so are they in-house occupational health based on that particular organisation, or are they part of an outsourced body or community that the company effectively buys in? That's going to affect the collaborations they can build. Secondly, occupational health spaces are about making sure how can we make occupational health accessible for all. As I said, it's limited numbers of people at the moment who can access this through their workplaces. We know that those in small to medium sized enterprises are particularly at risk of not having occupational health provision. So how can we make sure at a macro level we allow it to be an accessible healthcare provision for all? We know that occupational health can have best practice and also co-learnings between HR and health and well-being. So making sure that we bring together the knowledge bases and expertise so that we're doing what's best for employees in effective ways. And then, of course, there's the education aspect around clinical aspects of menopause that they can really help provide to the organisation. And then finally, I think we have to think about what are the cultures in occupational health that really help provide support for menopausal women. As I mentioned earlier, we need to think about the diversity of the profession. How do we get more women to be occupational health physicians? How do we make sure that more women are at the table, or those from kind of minority ethnic communities? So we have a diversity of bodies in the profession, shaping the profession to create an inclusive environment that supports menopause. We need the potential to integrate those clinical expertise with that kind of workplace and more social cultural understanding of menopause, so that we're aware of some of those barriers and enablers that we can address in thinking about supportive menopause practice. And then finally, I think the key aspect about occupational health is its potential to be not necessarily a condition-centred approach to menopause, but a people-centred approach to menopause. What works for menopausal employees to help them stay healthy and stay engaged in paid work. Because we know ultimately that those who stay in work, those who are in supportive environments, are not only likely to have better health outcomes, but also better employee health outcomes, and help us really kind of use that talented workforce of menopausal employees in society. So thank you so much. I'm very welcome to further correspondence or connecting on LinkedIn, and happy Menopause at Work Day. Thank you.
Many thanks to Kathleen for that very thoughtful presentation. As you read, you're more than welcome to contact her and find her on LinkedIn. I personally found this number impressive: 14 million working days lost due to the lack of menopause support each year. So there's lots to do still, I guess. However, I always wonder how they track these days, actually, because I'm sure that a lot of women don't go to the doctor and say, I want to be on sick leave because of menopausal symptoms, but that's another question, I guess. Well, let's move on to our next presentation. I'm pleased to introduce Rachel Suff from the Chartered Institute of Personnel and Development in the UK. She will share the HR perspective, showing how organizations can address menopause through workplace policies and supportive practices. Rachel cannot join us live either today, so this is also a recorded session. Still, I guess her expertise provides an important contribution to our discussion. So let's hear from Rachel.
Hello, everybody. I'm delighted to be here for the CIPD. My name's Rachel Suff, and I work in the UK for the Chartered Institute of Personnel and Development. So pleased to contribute to EMAS's event to celebrate Menopause in the Workplace Day. Brilliant to raise awareness. So just a little bit about CIPD on the next slide. As I said, we're based in the UK, but we've got offices overseas. We're a global organisation. We have 160,000 members worldwide, and we are the professional body for HR and people development. Just to draw your attention on the right-hand side to our purpose, which is to champion better work and working lives. And that means that supporting people's health and well-being at work is central to our purpose, and that includes around the menopause. And we've been working for several years in the UK with other stakeholders to improve support for menopause. First of all, I'm sure we're all very aware, but why is menopause transition an important workplace issue? And it's this rationale, this bigger context in terms of employers that has really helped to drive so much successful action in the UK. As we all know, it's about gender equality, it's about the economic participation of women at work, and there is a really strong business rationale there. In the UK, we have a tight labour market, which means there's a shortage of skills and talent, and we just simply can't afford to lose such a valuable group of the labour force because of what is a natural life event. And it is a genuine fluctuating health condition for many. We have about 6 million women in the typical menopausal age bracket in work in the UK, and that's an awful lot of people that make up the labour market. So there is such a strong business argument for making support available, but also just creating understanding and support for those who are experiencing menopause transition. And there is, of course, a strong compliance case. In the UK, we have, as in many European countries, a strong duty of care that's laid down in legislation in terms of looking after people's health and well-being at work. There's also, of course, a strong equalities dimension. And we know that the number of tribunal cases, so legal cases, in the UK has been increasing, where women feel that they have been discriminated against, very often in terms of their sex, age, and disability. But also, aside from all the strong business and legal arguments, it's definitely 100% the right thing to do. Employers need to value and look after their workforce. So, moving on, just one slide that shows the extent of employer support for women's and reproductive health. And it is very variable. This is the CIPD Simply Health and Wellbeing at Work survey report, and it's through the eyes of HR professionals, because of course we are the professional body for that professional group, and they will often be typically leading on health and wellbeing in organisations, so they are very well placed to tell us what the position is. And we can see that in terms of challenges and health issues that people experience through the life course, such as care and responsibilities, bereavement, pregnancy and baby loss, fertility challenges, we can see from this graph that support is very mixed in terms of the workplace. But what we do see is that menopause transition and the extent of provision around that, so it could be a policy, guidance, training, awareness raising activities, is actually third. It has really risen up the priorities in terms of focus by employers. So that's good news. Yes, there's increasing employer awareness and support for menopause in the UK, and this graph shows that around half of organisations think that they encourage an open and supportive climate where people can talk about the menopause. And on the second pie chart, almost as many, 46% of organisations include provision for menopause as part of their wellbeing activity. And that has increased from about 1 in 10 employers, say 5 or 6 years ago. So we have seen steady progress. But we also know that the gap in menopause is still there and it needs to close completely so that every woman, wherever they work, will know that if they experience symptoms, need support in terms of seeking help, adjustments with their workload, just balancing the impact of those menopausal symptoms. They need to know that they can approach their employer, they will receive understanding and support. So this is research that we carried out in 2023 with women, quite a large diverse sample of those in the typical menopause age bracket 40 to 60. So we wanted to know what their experience around menopause was at work. And first of all, a sobering finding was that a lack of support can have serious consequences for career progression, which is exactly what we don't want in terms of what I said earlier. Women need to be able to fulfill their potential at work, and the economy and employers need that as well. But what we found was that more than a quarter with menopause symptoms think that the menopause has had a negative impact on their career progression. That's not a surprising finding, but it's still really disappointing. And then this is one person's experience, which is quite hard hitting. And she told us that I've been unable to continue a career which I had developed over a period of 25 plus years due to being unsupported with symptoms of brain fog, extreme fatigue, mood swings, stress, and this had led me to having to take part-time low-paid work. And that is so disappointing because of those menopause symptoms, because of a lack of support. There are wider impacts through our research quite clearly for many women. For example, around a quarter almost had considered leaving work or had already left work due to a lack of support for their menopause symptoms. Unsurprisingly, those women with a disability or a pre-existing long-term health condition found that the impact of not having support through menopause was exacerbated, so the impacts were more serious for those. And then also individuals who did feel unsupported by their employer and the wider organisation as well were significantly more likely to report an increased amount of pressure or stress. Again, something that individuals and workplaces really need to avoid. And then on the fourth bullet, at some point, not surprisingly, just over half of women with menopause symptoms had been unable to go into work at some point because of them, because they had been so debilitating. And many felt unable to tell their manager the real reason for their absence, which speaks to the continuing stigma around menopause in many workplaces. On the plus side, we've also found that support and understanding from the organisation, from managers, from your colleagues can make a huge difference to how people manage work, the impact of their menopause symptoms on work, and just really enable people to carry on working in a productive and fulfilling way. So there is real potential here for employers to make a difference. And then continuing on this slide first, it is about offering helpful support and policies at work. And on the next slide, which I just gave you a little glimpse of there, we've got evidence-based information on what kind of support would be most helpful. So I'm going to save that third pillar until the next slide. Another fourth pillar, which is crucial to providing a supportive workplace around menopause, is the role of the line manager and making sure that HR and the organisation provides training and support for managers so that they are confident, they're capable in this area, they're not embarrassed about conversations to do with the menopause. This doesn't mean, of course, that we want line managers to be counsellors or medical experts. Far from it. Their role isn't to give advice, but it is to help people in their team going through menopause with the work aspects of their situation. First of all, ensuring that work is not part of the problem, doesn't exacerbate the impact of their symptoms, but it is to be educated at a general level around what some of the symptoms can be around menopause, what it means, and also what kind of adjustments and support and policies can help. At the first instance, it just means being approachable, feeling confidence to have sensitive conversations with people, and also have an individually focused conversation, because everybody experiences menopause differently and people will react differently. So what they need from work will vary according to their experience of menopause and also their job as well. But they are that gateway to helpful policies and support, also knowing how to manage absence and leave in a flexible and supportive way, because somebody will possibly need to take absence at some point. There could be appointments, but also just feeling unwell with menopause symptoms. So they need to understand that absence policies need to take on board and be flexible around menopause. Just my last slide. This is what women experiencing menopause told us through the survey that we conducted. What are the most helpful types of support to help you manage menopause? And top of the list was having flexibility. So this could be temporary or a permanent arrangement, but it's where you plan with your organisation and manager how you could flex your hours, perhaps work less hours, if you could work from home if your job allows that, or even stagger your shift time if you've had a terrible night's sleep. That could be really helpful. Secondly, temperature, being able to control the temperature. Experiencing sweats and hot flushes are one of the main symptoms of menopause, so it absolutely makes sense that you need to be able to have a desk fan or just cool air conditioning. And then also, I've already mentioned on the third point, having last minute flexibility. So if you have had a terrible night's sleep, which I often did, being able to start a bit later if possible. Having regular breaks, this is working down the list. And then having the support from a specialist health service like occupational health can help, or counselling if you're experiencing psychological impacts. Other adjustments as well to your work responsibilities and workload can help. Having access to a restroom or a break room was found to be valuable. And then uniform can be synthetic fibre, can be just not designed and constructed for people going through the menopause. So having clothing changes, but also thinking about how your uniform policy is going to affect somebody going through menopause symptoms. And then a bathroom, which goes without saying, but not everybody gets access to that. I hope this is helpful. Happy Workplace Menopause Day, and thank you very much.
Thanks a lot to Rachel for sharing this HR perspective. Again, if you'd like to have more information, you can find the CIPD's research and resources on their official website. And I think I'll now hand over back to Petra, who will take us into our second poll.
Yes, indeed. So now we want to know more about you and your experiences. So Lena is going to give us a few more questions. I will read the questions to you, and you can select up to 2 options. So the first one would be the question first, of course. So which of the following would most improve your workplace experience during menopause? So again, select up to 2 options. First one, flexible hours or breaks. Then manager awareness and training. Temperature and comfort adjustments. clear policy or written guidance, access to menopause-informed healthcare, and finally, open, supportive culture. So please vote now, and I'm very curious about the percentages for each answer.
We'll give a few seconds more since our audience is still voting.
Okay, so here we have the results. 48%, so half of you think flexible hours or breaks would help. Then we have the second most frequently answer was manager awareness and training, 38%. And then about more, we have another one with 33% is open supportive culture. And all the other answers are also quite frequently, voted for. So I think more or less we can say that most of our options that we gave you as an answer are, supported with yes. So thank you for sharing your views in the poll. And again, the responses highlight just how many different measures can make a real difference in the workplace. There isn't a single solution, but these results show how many or how practical steps can have an impact on everyday working life. So to look at this from a research perspective, I'm very pleased to introduce Professor Andrea Rumler from the Berlin School of Economics and Law in Germany. Andrea led the menopause studies that were carried out in Germany and Austria, and more recently in Switzerland. I'm very happy that I could, together with her, do this study in Switzerland. So these studies highlight not only the personal and professional impact of menopause, but also the significant economic consequences for companies and society. So Andrea, I'm very happy to see you again, and
yes,
the floor is yours.
Thanks. Presentation fine like this? Can you see?
Yes, it is.
Great.
Yes.
Okay. Thank you, everybody, that you're hanging in to hear my presentation. You will hear quite a few numbers, and I think they're exciting numbers, and you will see some recurring topics from the speeches we saw before. And for those of you, probably most of the non-Germans don't know our German Support project. It was a project that lasted for 2 years, was funded by Berlin government. We had a few partners from in form of companies, which was mandatory to get the funding, and a partner university. And we published it 2 years ago, the first comprehensive study on menopause in the workplace in Germany. And since this is sort of the main data, we did an online survey, a web-based questionnaire, and we had over 2,000 participants. And I'm sure you can read the topics yourself. And this is the topics we've been discussing over the last hour and a half. What are the effects of menopause and career decisions? What are personal experiences, coping strategies, and what measures are in place already? So we did this in Germany. And since this got quite, media echo, we decided with partners to repeat it in Austria, in Switzerland. And Switzerland, we really, I think 3 days ago, published the results in the first place. And we, in Austria and Switzerland, which are much smaller than Germany, we even managed to have comparably much higher samples. So I think we're really fortunate to have had wonderful partners. You can see for yourself. So we had a menopause portal in Austria, and Petra Stute and her her hospital, the hospital she's working for, Inselspital Bern, and the company, the Women's Circle. We adapted the studies language-wise, and yes, Austrian German and German German, and also Swiss German are slightly different, but mostly the same. And the Swiss study we did in 3 languages, so French and Italian. And I would like to show you, some of the results in comparison. And this is what I picked, just a few topics because we don't have that much time, but we'll start by looking at the demographics. And this is how many women are working full-time and part-time who participated in our study. And you see in Germany it was more or less half-half, a little bit more full-time working in Austria and more part-time working in Switzerland. This is not because our samples were different, because this is representing reality of women in the country. So we have more women working part-time in Switzerland because childcare is even worse than in Germany and even worse than in other countries. Looking at educational background, you can tell already with one glance that we had a sample with a high formal training. And this means, keep this in mind, that this study is not representative. This was self-selected samples of women telling us about their experience in the workplace. If you look at the right side, you see the age spans of our participants and the average age, and you can see that we managed to have very, very similar samples, again, by self-selecting. So women, we posted the link on, lots of different social media accounts or media accounts, and women decided to participate. So again, you can see samples are quite comparable, but they are not representative for the population. So the first topic I'm bringing to show you is the question, is menopause still a taboo topic at work? And in the German sample, we had 52% of participants saying, yes, it's a taboo topic in my workplace. No, said a quarter, not sure, said another quarter. The number of people who said it's a taboo topic slightly went down in Austria and Switzerland. My personal interpretation is because we did it with a gap of a year in between. So we can see here, this, at least in my interpretation, that more in the workplace. And said it's influence on menopause on the ability to work in comparison in our 3 countries, and it seems like my connection is unstable. I hope you can still hear me.
Yes, we can hear you, Andrea. Thank you.
Same ranking, problems of concentration, feeling more stressed, being less patient with others, and less confident in my abilities. Exact same ranking in numbers. So it seems like this shows pretty well how menopause is affecting the ability to work. And if you just take this 2/3 or 3/4 of women said we have problems to concentrate, this is dramatic. We took this question orally from the UK study from 2021. And here you see more or less the same, more dramatic. Again, keep in mind it was 2 years before we started our studies. So British women reported the same problems in the workplace, the same severe problems in the workplace because of their menopause systems. Next topic, and this has been touched upon in several of the talks we heard before, what are the influences of menopausal symptoms on career decisions. So we asked, first of all, did it influence your career? And as you can see, the slight majority of women said, no, it hasn't influenced my career. But this means that like 2/5, 45% of women's careers have been influenced by menopause. And the number one influence is that women are working less because of their symptoms, their untreated symptoms, by the way. If they had better help, I don't think the numbers would be that high. Germany changed employer or job, and 13 or 16% took time off work. This is like every seventh woman took time off work because of her menopause symptoms. And retiring earlier, this might seem not as dramatic, but it's very dramatic for the individual careers and for the individual pension plans of the women. So it means she has less money when she's aging. And we asked the same question to women 55 and older. I'm not showing this. Here the numbers really went up. So a lot of them, like 15 to 20%, have retired earlier or are planning on doing so. Facilities and so on. And the number one support, you see the numbers higher in Germany, enabling work from home, some home office. This is the same as in the general population. Germany is the number one home office country in Europe. So it's quite popular to offer this, and women are grateful for it. Flexible working time, you can see for yourself. Air-conditioned workplaces, a flexible organization of work tasks, and what women are also talking about, this the last topic, exchange opportunities with other women in the company. So, but it's only, again, 1 in 7 women, meaning 6 in 7 women don't have the opportunity yet. And after we asked this question, what is already available in your company, we asked, what would you like to have in your company if you don't have it? And now we see very different topics at the very top, and this is the same in all 3 countries. Women want their managers to be aware of what menopause means for women, male and female managers. This is the number one thing women are asking for, and they want a more menopause-friendly work culture. We heard this at the very beginning of the session, and somebody said that you can talk openly about that you are undergoing menopause and that you are having problems. Then we have a long list of other things women would like: flexible work time, open communication, sports, relaxation classes, and information programs. And this is quite popular and very similar in the 3 different countries. And that was already the insight into what we did. There's much more in results. So we have it's a very long study, but I tried to pick the most important topic. Thank you for listening to me. And if there are any questions, I'll be happy to answer them.
Thank you very much, Andrea, for this wonderful presentation. I think at least we are in the German-speaking countries. We are very, very happy that with the help of you, now we have data for our countries. And I just wonder if we have a mix of questions in the chat and also in the in our Q&A section. So there was one question about if we have data from Brazil. I think, and this leads me to the question that's that so many countries have gathered information, and I wonder, do you have an overview if someone puts all these data together so that we have like a global view, or how is the situation?
Question to me, right?
Yeah, question to
I
you.
have no clue.
Yeah.
And you know, I'm not from the I don't have a medical background. I have a business background. I still have to teach. I would love to do this, but I don't have the time. And I also think that it would be quite hard because we have very different databases, different times and whatever, but somebody should do it.
Yeah.
I think the positive light I'm seeing is we have at least in Germany, the first PhD students who are writing about menopause in the workplace. So I've given several interviews. I have also a PhD student myself. So I'm hoping they will do the work for us over the next 2 or 3 years, because I wouldn't know of anybody else who does it.
And another question that is always on my mind, and also on Judith and my minds, is that do you think the reason why so many companies are not that interested into this topic in the moment is because we have not evidence-based interventions that really prove that this or that intervention is effective? That, for example, the numbers of sick leave days is reduced, or do you see other barriers?
I see other barriers too, but this is a very important topic. And sort of the good news is we are currently talking to government agencies in Germany about additional research funding. And they've been aware that this is a topic, and I'm expecting money sort of to come into this topic, but sometime next year. So they've been aware of the fact that it would be really helpful if we have evidence-based data on what really helps. Although I think this is, I think this is not that easy to achieve. You can't split a company in half and, have half of the women have access to information, the other half hasn't. And it's very hard to find two comparable companies. But in some way, we will test it. But you know how long research takes. So I would say the results will be out in 4 years.
Yeah.
The other part of the question is why are companies not that interested? Well, many it's a difficult question, and there is a variety of reasons. Let's start with the women in management. Many of them have fought their way up. Many of them have, they have, by the way, there was a really informative study on female managers in Germany that was published this year. They have the same symptoms as all other women. They suffer as much,
guys.
the same, with one exception. They are not handing in Krankschreibung, so they don't go to the doctor that the doctor gives them a certificate of illness. So they work although they are feeling terrible. So female managers, most of them are very hesitant to talk about their own symptoms, and sort of they expect the women working for them to be as brave as well, because they are fearing discrimination for this reason. This is one of the aspects. Other women say, I didn't suffer, so it can't, you can't suffer. I'm sure you've heard this argument, which is stupid. And by the way, the female managers, 90% of them reported symptoms. Other reasons companies are not interested is, they think it will cost them money. They say, oh, we have so many other problems. Do we really have to take care of this on top of the long list of other things? But once companies have realized that women are in the age, let's call it 55 plus, are leaving in great numbers, they realize they have to do something. And I would like to give a sort of industry example, and that's not a company, it's the police force. Police women have terrible work conditions when they're in menopause. No toilets, terrible uniforms where you're sweating like crazy because they are all made of artificial stuff that you can't really breathe in them, and they are leaving the police force in large numbers. So police has realized this now. You know, I have a feeling they're thinking about what can we do, what can we do, what can we do. This is in my, you know, I'm not an insider. They haven't really come to a conclusion. But this is what companies need to realize, that women are leaving them at least 10%, maybe even more, and that it's very expensive to replace them.
Thank you very, very much for your insights. And I think we have another poll. So, Lina, do you think we still can do it?
Yes, we can.
Okay, we get a yes. Okay, so and we are quite in time. Yes. So I think you want to do the third poll.
I want to do the poll.
Yes. Okay, please do it.
No, let's go ahead. What action are you most likely to take after this webinar? Choose one answer. Talk about menopause with someone at work. Explore resources and share them. Advocate for change in my organization. Learn more through EMAS and similar societies. I'm not sure yet, but I'm thinking about it. I already work in menopause. That's a weird question. Answer the last one.
Just a few more seconds.
Okay, so the last one, the weirdest one, has the most answers. So I am already working while being in menopausal transition is probably the answer. So yeah. Advocate for change in my organization. I think that's a big need, and that's probably where we want to go for. And the rest, I think it's equally distributed. More or less, right? Yeah.
Okay. So thank you very much. I think we already almost come to end. So I would like before I close our webinar, I would like to first of all thank everyone for the speakers for giving excellent presentations and for also helping us in this webinar and supporting EMAS with their time and experience. I also would like to thank Lina. You heard her voice from time to time. She's our strongest support from our business office kit, who's helping and supporting EMAS since many years. And of course, I also thank you, the audience, for discussing, for being part of this webinar. And as I already said at the beginning, we will collect all the questions and comments so that we can provide you with answers, because we all realized that we were not able to answer all your questions. But before I come to my final sentence, I would like to ask those who are still here from our speakers to give some final words to the audience. So who would like to share?
So maybe start with the order they started?
Oh, that's a good idea.
So Tuva. We don't hear you.
Sorry, surprise. And my final words are, if these issues are not addressed in the workplace, in my lay opinion, it's a form of bullying, of mobbing.
Thanks. Thank
Thank you very much for the
Thank
good organization and the presentation that you've made. Great job. My final words are about prevention. Think about it so that you can go through menopause with more success. Thank you.
Okay, thank you again. Thank you to all my colleagues. I think we complemented each other quite well in our presentation, so that was very enjoyable on my behalf. And it was great to hear the different perspectives and different contributions. I mean, my message is quite basic. I just think that if we want to promote evidence-based policy measures, we need the evidence, right? So we need more research. And we need more research from the range of disciplinary perspectives that we've had today and possibly others. So we need HR, we need sociologists of organizations, we need psychologists, we need medical gynecologists. We need more investment in order to really understand what's going on and in order to understand the most effective responses that we can bring to this issue. So yeah, that's my message, take-home message.
Okay, I'll go right after Nikki. Let's keep up the good work, I would say. I think, you know, we all achieved something over the past years. So let's continue. Let's not stop. Let nothing stop us.
I like that, Andrea. For me, it was really valuable to hear so many different voices come together. And that's exactly what we need if we want to continue the change, how menopause is addressed in the workplace. We need the data, I agree. And my hope is that you take today as a reminder to keep raising awareness, keep listening, keep exploring what can be done in your own sphere of influence. And then together, this is how we can hopefully move the conversation forward and hopefully sooner than later make real change happen.
Wonderful. So thank you again, all of you, for joining us today. So what we have heard makes it clear that the connection between menopause and work runs both ways. Menopause impacts work and work impacts menopause. And addressing this requires evidence, openness, and action, whether in healthcare, in HR, or in our own daily lives. So as president of the European Menopause and Andropause Society, I see our roles as bringing science and practice together. But the real change will come from all of us in our workplaces and communities. I hope you leave today inspired to take small, meaningful steps that can make a big difference. And with that, have a great